Hey, guys. I can't hear you.
Yeah, there you go. All
Now I
right,
can hear you.
we've been talking about you, so we didn't want you to hear.
That's okay. I'm glad that I'm that important.
Oh, you're extremely important. We only had good things to say about you. We're going to start very soon. We're expecting one more committee member, and then we'll get this meeting off the ground. So please bear with us. We're going to start very soon.
Okay, and I will have an announcement, something update from the ASBCA.
All right. Well, we're going to put you down under old business.
Okay.
No. Okay, great. So take a seat.
My new nickname is Quorum.
Close to it, yes. You're the
Don't worry about it, Steve.
you're the Shabbos Forum. That makes no sense. Okay,
It's exactly what you meant to say.
yeah. All right, we've been joined by our fourth member, Richard Allman. Thank you all for waiting. We're gonna call this meeting to order at 7:09. My name is Steve Simon. I'm the chair of the committee. I'm joined by my assistant chair, who is on the Zoom, OC Camina, and by my other committee members, Richard Allman, Heidi Guzman, and Jacob Banis. Just want to begin by saying that as we do every year, it's been our tradition to observe World AIDS Day, even though the federal government shamefully has decided to no longer observe World AIDS Day. I guess maybe the president has figured he issued an executive order and somehow got rid of AIDS completely and didn't let anyone else know. They're not observing World AIDS Day, but we will. In a moment, we're going to be joined by Dr. Peter Gordon from New York Presbyterian Hospital. But let me also mention that, as I also do when I begin these meetings, that according to the Daily News, not only was Monday World AIDS Day, but but yesterday was International Day of Persons with Disabilities. Early December is a National Hand Washing Awareness Week. I hope there's something that we all do any case.
Uh-oh.
Okay.
What happened?
No.
Can they still hear me?
Yeah.
Okay.
Just cause I got off and you're the host now. I'm sure you started from there.
But
The
it
meeting is on.
is it's still recording. Okay.
Oh.
All right. So it's as I mentioned, National Hand Washing Awareness Week, which is something we should do every week, not just this week. It's Safe Toys and Gifts Month. That's appropriate. National Influenza Vaccination Month. If you haven't gotten your flu shot, you should do so. Universal Health Coverage Day is December the 12th. It's Seasonal Affective Disorder Awareness Month, National Drunk and Drugged Driving Prevention Month, Winter Wellness and Injury Prevention Awareness Month, National Stress-Free Family Holidays Month. Oh, I hope that works out. And National Impaired Driving Prevention Month. So we got a busy month here. I'm going to bring on Dr. Gordon in a moment, but I may steal some of his thunder. So let me just put his presentation in some context. HIV remains a major global public health challenge, claiming 44.1 million lives and continuing transmission worldwide, affecting millions in every country across all continents and populations. And even though that's happening, our federal government has decided to cease providing aid to countries all over the world, which has helped to prevent deaths and transmission. At the end of 2024, an estimated 40.8 million people were living with HIV, with 65% concentrated in Africa, highlighting persistent geographic disparities. In 2024 alone, around 630,000 people died from HIV-related causes, and approximately 1.3 million individuals were newly infected, emphasizing the ongoing global burden of the epidemic. There is currently no cure for HIV, but effective prevention, diagnosis, treatment, and care enable it to be a manageable chronic condition for long, healthy lives. Global targets aim for 95% diagnosed, 95% of those on treatment, and 95% of viral suppression by 2025. Well, we're in 2025. While in 2024, the figures were 87%, 77%, and 73% respectively. I know that it's Dr. Gordon's goal to completely eliminate HIV and AIDS, and he's going to tell us what kind of progress he thinks we're making. I just want to conclude my little intro by saying that last year when he came before us, he told us that in our district, Community District 12, which runs from 155th Street to 220th Street in Northern Manhattan, that between 15.2 to 27.5 per 100,000 people were diagnosed with HIV in 2023, which at that point was the most current data available. So hopefully he's going to tell us that things have improved. Dr. Gordon is the medical director for the Comprehensive Health Program at New York Presbyterian Hospital, and we are so pleased that he has once again agreed to join us. Do you want to take a seat at the table?
Sure. Thanks. I'm going to bring you on the road with me going forward. That was quite a very good summary of epidemiology. Thanks for having me. I always enjoy coming and giving this talk each year. I have to say, it's going to be a mixed good news, bad news talk this year. I didn't bring slides this year. I thought there might be questions.
It should be.
Yeah.
Rusty, can you hear him? Thank you.
I'm just gonna move out of it.
Look, can you see him?
Yes, I
Oh,
can
good.
hear and see.
Okay, very good.
You, all of you.
yeah. No, that's you don't have to see me, but I want you to see Dr. Gordon.
I'll start just with a few more local statistics of New York
Yeah, please.
City, and then I'll give some, I think, encouraging news that I've heard of last year, and then I'll end with more concerning developments. I think, as you all know, New York City was and remains the epicenter of the HIV epidemic in the United States. About 1 in 11 people living with HIV live in New York City. In 2014, the state and followed by the city issued a plan to end the epidemic by 2020 in New York City and New York State. We were largely on track for that, but then COVID hit in 2020 and there was major disruption to the care delivery system. Currently, about 92,000 people are thought to be living with HIV in New York City. About 94% know their diagnosis. So about 5,500 people out of the 8.5 million people living in New York City don't know their diagnosis. The pillars of the end of the epidemic initiative in New York State was to test everyone, to find, the last 5,000 people so they know their HIV status, because if you're diagnosed with HIV 2025, you can expect to live a healthy, normal, long lifespan, have kids with an undetectable viral load, you can have sex with outcomes if you choose, with no risk of transmitting HIV. Undetectable is consistent with being non-transmissible. It's a sort of powerful anti-stigma message that we like to send. A lot of individuals living with HIV and often felt like they were at risk of infecting other people, and in fact, when they find out they're not because they're on treatment, it changes the way they view carrying a diagnosis, so that it's of no more great import than a diagnosis of hypertension or diabetes or any other chronic illness. So every year we were seeing less new diagnoses in New York City. The goal was to get down to about 1,500. In the last year, in 2024, this report just came out at World AIDS Day. You're going to leave this behind. This is the annual surveillance report from the DOH. And for the first time in 20 years, new diagnoses have gone up, not down, in New York City. They increased by at least 5%. And the thought is new infections, which is different than new diagnoses, maybe up 15 to 20% in New York City. And really, that is an ominous development, because we had seen remarkable decreases in the prior 15 and 20 years each year, less people being diagnosed and less people being infected. And this report is from 2024. So this is even before the projected cuts that we're looking at for 2026, before the new administration is probably the results of the disruption of the healthcare delivery system from 2020 and has continued. Here at Presbyterian has, I'm an employee of Columbia University, even though I'm the medical director of the HIV program at the hospital. I have to say I'm very proud of the institution. They've really committed a lot of resources to the end of the epidemic. As you know, we field a sexual health mobile medical unit now, which goes to many boroughs in New York with the highest rates of new infection, and provide free, unfettered access to sexual health services and HIV prevention services in Manhattan, Bronx, Queens, and Brooklyn. Our clinics across the street are free to anyone in need. You need not have health insurance. You can come in and we can ensure full sexual health services and access to PrEP, which is pre-exposure prophylaxis. That really gets me to talk about a remarkable development in 2025, which was the approval of a drug called lenacapavir. Have you guys heard of lenacapavir before? When I first started treating people living with HIV, I had some patients on 25 and 30 pills a day. And gradually it went down to a couple pills a day and then 1 pill a day. And that's been a huge advantage. But there are folks who just have a hard time taking medicine every day. It just reminds them of being HIV positive. And so something called long-acting antiretroviral therapy became available a few years ago. There's a drug called Cabenuva, which we can now give a person an injection every 2 months. They don't have to take medicine every day. It keeps them free of HIV. And another drug came out, which is injected now once every 6 months. And while that alone can't be given to someone with HIV, it turns out that it can be given to people who are at risk for HIV. And it's 100% protective against HIV, 100%. And this was, based on a study done in Sub-Saharan Africa. It's called lenacapavir. And it's an injection that lasts 6 months, and compared to the standard of care, it's unbelievably effective. We've been trying to get a vaccine for HIV for 40 years. We still don't have that, but if you think about a shot that you just get twice a year, that's not much difference than a flu shot. And in fact, the formulation where it'll be one shot a year, just like a flu shot, is already in clinical trials.
Is this being offered at the hospital?
This is being offered at the hospital. And even though it's, $36,000 if you have to pay for it for an injection,
One injection?
for one injection, it lasts 6 months. We can get it free for individuals through the manufacturer for anyone who needs it. So,
And what category of people would that be?
well, the pillars have been.
How do you determine who should get it?
Sure, so, right now, people considered eligible for HIV pre-exposure prophylaxis, PrEP, is anyone who's having sex with a partner who they don't know if it's a monogamous relationship or not, or multiple partners. So that's, the thought is there's probably, easily 200,000 people who are eligible for PrEP in New York City. To tell you a little bit about this PrEP season, who actually is on PrEP, if you're a gay white male, you have about a 8 out of 9 chance of being on PrEP currently. If you're an African American gay man, you have about a 20% chance of being PrEP. If you're a heterosexual woman who's Black at risk for HIV, you have about a 3% chance of being PrEP. So even though we have medications that are 100% effective, there is enormous differences in who knows about the medicine and who feels they have access to the medicine. If you think about an injection that you take twice a year or once a year, I mean, to put it in perspective, in sub-Saharan Africa right now, 3,300 young women are infected each week with HIV. So the rollout of lenacapavir to sub-Saharan Africa is really thought to be potentially the ultimate game changer. It's not a vaccine, but it's drawing close to being a vaccine for HIV. The drug companies have sort of made motions that they're going to make it available at costs where it could be deployed. Yeah, but here in New York City, which is the richest city the world has ever known, we're still not getting the word out to people who would benefit from it. As a result, this is one of the contributors, we think, to why new infections may be up 15, 17, 20%. The current administration is sowing a lot of concerns about medicine, where there's vaccines or other medicines. We're not getting all of the epidemiologic data that we want to get. We use that data to understand, well, like, where do we send the mobile medical unit to make sure that people in communities that might be healthcare deserts have access to this care. And so, this is a strange World AIDS Day. Usually I come here and I say more progress is made, we're on target, but we're not on target anymore. Even though we had a new drug, which is a powerful new tool in the arsenal to end HIV. And we're really looking to work with local community boards and community-based organizations to better understand what we can do to popularize that in this neighborhood and really most neighborhoods in New York City. We have access to these life-saving medications that both treat HIV and are also highly effective for prevention of HIV. We're moving away from really just talking about HIV prevention and instead talking about sexual health, because as you probably all know, there's been an epidemic of syphilis in the city, which has been really unbelievable. It's moved into the perinatal population. There's more kids born with syphilis in the last 2 years than there had been 20 years beforehand. Gonorrhea and chlamydia rates are maybe turning the corner, coming down, but they're at all-time historic highs. So we're really trying to bundle services, not just to be HIV prevention, but really putting it in the terms of sexual health, making sure that young people, middle-aged people, old people, because old people have sex too, have access to free sexual health services. And Julio, I was saying before you came in that the hospital has made major investments in this access, not just at the medical center here, but at the Cornell campus, Brooklyn Methodist, and in Queens. We have over 12 care delivery grants that allow us to provide these services to anyone who needs it. I guess I'll end there and see if anyone has questions. I think you probably heard that they're talking about ending the HIV prevention branch of the CDC. That would be a cut of a $755 million project that funds a lot of the work that I'm telling you about. We have a CDC grant, which provides a lot of care equipment right now. It's estimated that New York City is going to lose $41 million in HIV prevention funding if that goes through, that cut. And of course, the cuts to the state Medicaid system threaten EDAP, which is the AIDS Drug Assistance Program, the viability of it, which provides free access to HIV medications and healthcare for individuals who might be undocumented or have no insurance. And so we're looking at that for the state is really looking at that and trying to figure out how to mitigate the projected shortfalls, which are massive, based on the cuts to Medicaid that are coming through.
So has the hospital itself experienced an increased workload with these increased cases?
Yes, I mean, we write grants all the time. We're ready to take care of anyone that can be sent to us or anyone who wants to have access to care, whether it's HIV care or prevention care. Yes, the workload is going up where we need to do a lot of work to ensure people who have ADAP don't lose their coverage with these projected cuts. And there are ways to do that. We're moving them onto other aid programs and also signing them up for the APIC program in New York State, which is provides insurance by using ADAP premiums to pay for exchange.
And then ADAP stands for?
AIDS Drug Assistance Program is part of the Ryan-White Care Act.
Oh, okay.
And so New York State gets hundreds of millions of dollars from the federal government.
And those are continuing? Those have not been cut off?
Those have not been cut off yet. And it's the Medicaid dollars that really look, I think their projected shortfall in New York State is $8 billion.
Yeah. Because of the big beautiful bill. Yeah.
Because of the big beautiful bill.
Yeah.
Big bill.
So but can you quantify what the increased workload has been in the last year or so?
The increased workload in the last year, we've seen a lot of programs in other.
Actually, I don't even want to use the word workload. That sounds so bureaucratic. I mean, the increased number of people who are coming to you requesting services.
Yeah, we've seen hundreds of people come in requesting HIV services. Many immigrants from Venezuela. We have a program where we work with a CBO that brings us folks who are HIV positive who are coming in, but many other HIV programs in New York State, the hospitals that situate them and house them are under enormous financial strain and have issued cutbacks. NYP has not cut back. Actually, it continues to invest in the sexual health program and HIV programs. And so we're seeing both new cases, new diagnoses. We have programs that use informatics to identify people when they touch the emergency rooms if they've fallen out of HIV care. And we're pulling them in by the hundreds into care using care navigation, community health workers, and other folks. So our workload has gone up a lot, Steve, but a lot of it has been based on increased outreach that we do to find people who are lost to care. About 10 to 15,000 people living with HIV or out of care in New York City at any given time. And so we have lots of programs that try to.
And is there, what is the waiting time before when people make their, show up at your program, and how long do they have to wait before they can get any services?
Zero. We guarantee people same day access to sexual health services and to HIV services.
Really?
And this was part of a grant, a practice transformation grant we got some years ago. We retooled the entire program to be able to have a navigator bring a person in, and we diagnose them, we treat them, we start them on medicine the same day.
They can just show up without an appointment.
They can just show up without an appointment.
Let me just ask one other. The mobile unit. I know it covers a pretty wide area, but of course we're somewhat parochial. We're particularly concerned about Washington Heights and Inwood. So how often is the mobile unit here within our community?
Not often, and the reason for it is that we're one of the, I think we're really the only place in New York City that can see people the same day, and people can just walk in and be seen. And I think many of the CBOs we work with in the neighborhood know that. They just bring people here to the medical center into our program. The mobile medical unit is a wonderful, wonderful outreach vehicle, but it's small. We have over 100 people who work in the program across the street on 2 floors. And so our capacity is just 100 times greater in the clinics than it is on an MMU. And quite frankly, we don't necessarily need it here in this because we have this open access model, which I think people are fairly well aware of. The places it goes are true healthcare deserts, and so that's where.
So if someone shows up at the Allen Hospital, seeking the service, what are they quickly referred downtown to?
Yeah, they're more than referred, they're navigated. We have community health workers and care coordinators where if need be, will assist the person coming down. We work on transportation. We work to get them housing that evening by getting them into HASA. So yeah, we work with people like Alliance for Positive Change and Margus, many other CBOs where we share support of community health workers to do this work. I would say I'm a huge fan of community health workers. There's been pending possible Medicaid changes which would allow them to bill for their services, and then we could really scale that program. And I would love to see that happen. We could benefit from having hundreds of community health workers rather than the handful that we have.
So the numbers that I read off earlier from 2023, 15.2 to, it's a pretty wide gap there. I mean, 15.2 to 27.5 for 100,000 people in our district diagnosed with HIV. Do you now have the numbers for 2024?
They're in this report.
Okay, so we'll look at the report.
I'll leave with you. We're in Washington Heights here. We're close to a hotspot of HIV infection, which is just across the river in the Bronx.
Yeah.
The highest rates of new infections, diagnoses are in neighborhoods, near us here in the Bronx.
But are we fairly high as well?
We're very high as well.
Yeah. All right, Richard.
Few questions, but first I want to pick up on your reference to aging people as part of this discussion. And two contexts that I manage senior centers and I'm aging. It's a multi-part question. What is it you're recommending in terms of education? It's a group of, I see places occasionally that the State Department for Aging will promote some programs around sexual education for older people, but not very often. I think I'd also say about older people who continue to see themselves as sexual people, they have the same capacity as an 18-year-old to do something dumb in this room. Reflections.
Yeah,
we
we actively market our sexual health services to older populations in Brooklyn and Prospect Park, for instance, or Grand Army Plaza, one of the places, and then sexual health and then you goes. We've actually spoken at senior centers about the access to sexual health services. In our HIV program across the street, we have 3 grants dedicated solely to aging with HIV. More than half the people living with HIV in New York City are now above the ages of 50. And they experience accelerated aging due to comorbidities that like hypertension and heart disease and diabetes that happen about 5 to 10 years earlier, people living with HIV. One of the things that is enormously problematic is the isolation of older people living with HIV. Our HIV and aging programs center on groups activities. I should have brought a video of this, the incredible group sessions. We have exercise group sessions and socialization sessions in spaces in NYP. They go out to the farmers market together, cooking, celebrations. It is singularly the best programs that we have started in the last 20 years for the HIV aging programs.
Are you within that? Are you seeing the need to separate genders in any way in doing this, or do things things that are targeted differently, different genders, I mean, I'd say my sub-question within that. I suspect that's more of a problem with straight people, than it is with people with same-sex attractions.
Yeah. You know, we have different groups for people who are primarily Spanish speaking versus English speaking. But right now the groups are mixed groups and actually they're really joyous and joyful activities. I mean, our clinic is just lit up on the days that we have the group meetings and, you know, 20, 25, 30 people coming, playing Twister sometimes, doing art projects, doing cooking projects. It's amazing, you know, really, if you've not been through this, you need to come. It's just, it just, you know, healthcare, having life-saving medications is the start of addressing the other root issues that affect, you know, the social determinants of people's health. Because, you know, it's critical.
And if I could make one comment here, deal with it later, but I think there's an appropriate resolution coming out of this over the importance of targeting diverse communities.
What's it?
Diverse,
Oh,
Yes.
that's a catch-all word.
So a lot of good things are happening, but there are a lot of problematic storm clouds on the horizon. You know, these cuts of 755 million to the CDC have not happened yet, but they're targeted for 2026. And many of our grants emanate from the federal government or the state or the city DOH, and they will certainly be impacted. We've had many grants paused in the last months and then they started. But currently we're open for business and any way we can continue to promote awareness that these services are free and that all age groups are encouraged to take advantage of them. And we'll just keep writing grants and building the program and stay ahead of the curve and have the capacity to get this from.
but when Trump froze, what was it, $400 million worth of grants to Colombia, and then they cut a deal. Colombia had to pay a $200 million fine or something, and I guess ended up getting back in net 200 million. So they lost 200 million in the process. So you didn't suffer anything in that deal?
Yeah, we suffered in that deal, and continue to suffer, you know, from it. But one of the things I think which is important, I saw a talk last night with a woman who started the pediatric HIV program down at County Hospital, and it was how 4 or 5 or 6 people were committed to. You know, there was a time 1 in 6 kids born with HIV in this country was a problem. And it was like the center of the pediatric HIV.
Yeah.
And they did tremendous work. It grew into ICAP and MTCT plus and programs in Africa. But you can do a lot with the resources we still have. We still have a lot of resources, and we're worried about future, but we're always looking. You know, we can use the resources we have to be more efficient, to serve more people, to put out new programs.
We had a pediatric HIV program here some years ago, didn't we? With
Part of the program I oversee now,
Oh, okay.
as the numbers of pediatric patients fell, thankfully, we inculcated them into the larger program so that the adult program kind of subsidizes the pediatric program.
but we no longer have the was it infants or toddlers at near Incarnation Church on Audubon Avenue?
Yeah, I mean, in recent years, there's been 0 to 1 patient, young person being born with HIV in New York City. So we have a handful of people, you know, below 10 years of age, or some behaviorally infected 10 to 20. But fortunately, the pediatric HIV population, our epidemic in this country, has not really been solved. As long as we have
But you remember that program at Incarnation, right?
Yes, I do.
Yeah.
In fact, the woman who gave the talk last night was one of the individuals who's the founding member of that. Or
But it's no longer active, or
no,
because
and
you
in
said
fact, the last summer camp, she showed scenes of the last summer camp escape for the kids who like all aged out and
Oh.
now.
All right. Did you have anything? Heidi, go ahead.
So I just was looking through this report, and this page is about like access to care within 30 days and then viral suppression within 3 months, and there's obviously a discrepancy. I think the vast majority of people are getting care within those 30 days, and then there's a bit of a drop off to reaching viral suppression within 3 months. And I'm wondering if you could talk a little bit about what is that drop off, like what's happening there? I think you've kind of alluded to it, but it would just be good to.
Yeah, no, it's people getting lost to care.
Yeah.
And, you know, we do a lot of testing in the emergency rooms. We need to do a lot more testing in the emergency rooms. Someone who tests positive in the emergency room, confirmatory test has to be sent, because this is a characteristic of the test, but false positive screening tests are now outnumbering true positive screening tests because of the low prevalence of HIV in the general population. That confirmatory test doesn't come in for a day or two. And so by the time that comes in, people have left the emergency room and are not always contactable or traceable. And we try in the areas that we do a lot of outreach testing is to make sure we get more than one point of contact for the individual, not just a cell number, but understand like where the person hangs out on a regular basis, so that we can send an outreach worker if the phone doesn't work or the address is not to get them to care. But it's a huge issue.
And do you feel like having more these like care navigator people would be a helpful intervention in that circumstance?
Unquestionably.
Yeah.
If you look at the HIV care cascade about how like from diagnosis to treatment to undetectable viral load, we do pretty good with about 75% of people eventually getting through that. If you look at diabetes and hypertension, it's on the order of like 5 out of 100 people have blood pressure control when they hit it. We should have these navigators not just for HIV, but they should be going out and helping people get into care with, you know, underserved diabetes and hypertension. So everything that we've learned with the HIV model and prevention model should be invested in and then expanded to include other common chronic illnesses that are completely treatable, but are not in aggregate. I know I'm taking up a large part of your meeting, so I apologize.
Well, we only get you once a year. Are there any questions on the Zoom?
I didn't see any. I don't see any questions.
Yeah, OC, do you have anything? No? Okay, very good. Richard?
I want to take a minute here and to ask a question. So much as being of a certain age that I remember day one. All of this. The lack of knowledge. Fear. What it did to the community, what it did to the way we lived our lives. Yeah. A lot of us survived that. But it was just, you know, and it was happening at a time that the government support was much better than what's happening right now. That's right. Those are the right years. Lost a lot of people that, you know, maybe they were friends, lovers, maybe they were dates, maybe they were the people we were going to build the better world with. I think there will be people like that. I speak simply because it's a memory that doesn't go away. And then as much as we talk about where we are now, all the progress that's made, everything that's being done, make sure things keep getting educated, keep getting better, keep getting more inclusive. Please don't go away.
Right. Now,
Or should.
I did not start with a moment of silence, really, you know, but you've all seen the AIDS quilt picture on, and I can't get 2 panels down without choking up, you know, because 700,000 people died in this country. And it, you're right, it's a nice way to end this by taking a moment and just really honoring that memory.
But I'd say it was also the way they died, the way that people wasted away, the way they looked. It was just horrible. Just yeah.
I'm on service right now in the hospital, and it's like going back 35 years of the epidemics and folks we have on the floor who come in through the emergency room the last day or two because right in the midst of our communities, they're out of care, not on medicine, and they're presenting, 75 pounds, all sorts of, so we've come a long way and we should remember, but we have more work.
Norman, to you.
Yes, please, it's congratulations. That big deal here, all the pass away from that medical condition. He was very hardworking, one main young guy, and he started dating a good woman. That woman came infected. She don't know. She was a good girl. And as you mentioned, the family had to suffer, see how they lose weight. And even though by that time everybody doing well with the family, we couldn't do much for my program. And I developed a mental health program, calling help the mom, help the family, because at the end of the day, all the mother tried to help the member, not only the person and the family, the mother, but I'm sorry to read this because this touched my heart. As a child, I had to see all the process. And I was a child and I go with my mom to the hospital to visit my brother. Yeah, you
Right,
know.
right here.
Yes,
Right.
yes, my family here for me here and the city back to the country. And then I come back, finish my school with college anyway. And I developed this mental health program to educate people and eliminate stigma. They had to educate, they say educate to prevent, it's a prevention education mental health program. And when you talk about mental health program, you talk about sex orientation, talk about nutrition, talking about emotional, because people only talk about depression, psychiatry, all the stuff, schizophrenia. But mental health include everything what you just mentioned, self-care. And like he said to me, I always be volunteer with elderly. I have passion to work with mothers and elderly. However, my specialty is with children's. But at the end of the day, when people get old, they also is like compare emotional like a child. You have to be there to support them. And I go a lot of senior centers to help them and donating my service. Donating my service because they are alive. They need those kind of programs. They need it because they are alive and they have a lot of necessity. Thank you so much. My respect.
Richard, and then I think we'll wrap it up.
What I'd like to do is to pick up a little bit from your last words there, over the positive things you're seeing to do right now. What exists as a strong, vital, build out of resilience, build out of the ashes. Down through 100 years of history, there are many better examples of community organizing. People who didn't on the fly, that there was no precedent for, in a thoughtful way. That, maybe a couple of other movements. With farm workers, those things where people say, and is that the lesson for today? As we face the attacks, community goes. You see the formula for how to get there, but there's pockets out there.
All right, well, I think that's a note to end on. Thank you, Dr. Gordon, once again for coming.
For having me, Bill. And thank you for ending with those two stories, because I felt it's very powerful. I know, but I'm always felt with the book cross thing.
All right, then. All right, thank you, Dr. Gordon. Julio, are you coming back? All right, is Danielle Manga back with us?
Yes, I believe so. Online.
Danielle, are you with us?
Hi, I'm here.
Oh, very good. All right, so we're now going to get a presentation from on We Act. We Act as an organization that many of us are familiar with. The full name is We Act for Environmental Justice, and this is a presentation on We Act's environmental health updates and its climate ready uptown plan. And the speaker is Danielle Mangabat. I hope I'm pronouncing it correctly. The environmental health coordinator at We Act. Danielle, you have a presentation.
Yes, I shared it.
Um, oh,
Do you have it?
yeah, do you have it with you?
Yes, but I am not sure how I can share, um, on the Zoom.
Are
It
you able
seems
to give her?
I have
Yeah,
some
one
limited
second.
settings.
No,
Oh.
Danielle, I'm gonna give you permission to do that. You should see a prompt and you'll rejoin as the panelist. So you should be able to share your presentation with us now, I believe.
Oh, good, here it is.
Okay.
Oh, no.
Hi, I
That's-
just wanted to show
that's-
myself really quickly and
Hello.
say hello. Sorry I can't be there in person. I'm recovering from a sickness, so I don't want to be contagious.
Okay, well, in that case, we appreciate you staying away.
Yes. But it's nice meeting you all. I really appreciated learning a bit about the presentation before me as well, so it was really cool. So thank you for having me. I'm the environmental health coordinator at We Act for Environmental Justice, and I'm gonna share my screen. It's not in a, let me just configure this properly really quickly. Give me 1 second.
We see your screen.
Okay, perfect.
Okay.
So if folks aren't familiar with We Act really quickly, we're a nonprofit founded in 1988, and we're working to address environmental racism in West Harlem, mainly northern Manhattan, but we also work at the state, federal, and even international level on all things environmental justice, including policy, organizing, community-based research, and health issues, which is the team that I work on. And our mission is really to build healthy communities by ensuring that people of color and our low-income residents are participating meaningfully in the creation of sound and fair environmental health and protection policies and practices. So here are a few pictures from our different lobby days, our advocacy, our executive director, Peggy Shepard. But I'm excited to talk to you guys today about a few of the issues that we've been working on lately.
The first photo, I think, shows Cecil Corbin Mark.
Yes.
Yeah, somebody whom we had the opportunity to work with for a number of years and who left us really prematurely.
Yeah,
But
for sure. But his legacy definitely lives on in the work that we do. So yeah, we really appreciate him as well. Um, but yeah, so moving on. Um, this is the Climate Ready Uptown Plan. Is anyone familiar with this plan? I feel like it's been
no,
circulated.
you need, we are, you are? Okay, well, one of us is familiar, but
Okay.
the rest, but assume that you got to tell us about it in detail.
Yeah, 100%. So We Act for Environmental Justice really partnered with community-based organizations such as the East Harlem COAD and Harlem Emergency Network to create the Climate Ready Uptown Plan. What we do is we give a workshop, which is about 90 minutes, to different community-based organizations This past year, we worked with senior centers. We partnered with Riverside Park Conservancy. Who else do we partner with? Different representatives' offices to host them at local community centers. We also host them in youth spaces, and we have different variations of the presentation depending on the audiences. As well as we did one with Family Enrichment Center up in Washington Heights as well, and in the Juan Pablo Duarte Foundation office. But yeah, so this is a physical pamphlet that helps Northern Manhattan community members really understand their individual risk to climate-related disasters. So as we go through the workshop, we highlight different issues such as air quality risk issues, um, flooding, extreme heat, especially because it is the leading cause of weather-related death, um, especially in New York City. It's a very big issue in our city, especially with our unhoused populations, and it provides a lot of information to help folks prepare themselves and their families. I'm not sure if you can see it from the picture, but to the right-hand side, we have some kind of fill in the blanks for emergency contacts. And then on the left-hand side, you can see how throughout the workshop, we ask folks to personalize their plan by marking their homes, marking their closest evacuation centers, and looking at the different types of flooding that exists. So the pink indicates areas that are going to be impacted by kind of like flash flooding, and extreme rain. And then the blue is actually going to be coastal flooding. So there's quite a bit in Washington Heights of like the pink and the blue. Um, and there's also ways to identify safer bus stations around your home, as well as mapping your route to your evacuation center and finding Link NYC kiosks, which can actually be really helpful during large power outages or different disasters where you need to charge or get Wi-Fi. So again, we just host these crop workshops across Northern Manhattan from late spring to about early fall. Um, and we have these interactive pamphlets in both English and Spanish. We have emergency kit information in English and Spanish as well. So this includes what folks should be packing in a go bag, what folks should be prepared for at home when it comes to extreme weather, and the more and more that we see extreme weather in the news, this Climate Ready Uptown plan um, is more and more of a reality for us every day due to climate change. So if anyone here is a part of a CBO, or if your community members would like to have us host a crop workshop, we also have a form that folks can fill out, something that you can circulate with your networks, because we really try to work with different community-based organizations or different yeah, just different organizations where we can disseminate as much of this information as possible. Um, I'm going to move on to two other issues that we've been talking about, but I can definitely take questions about the Climate Ready Uptown plan as well. Um, and here's a nice little picture of us at the George Washington bus terminal of our Family Enrichment Center. This workshop was hosted in Spanish only, so that was really fun. We also have been working on pesticide awareness with the New York Attorney General Office, which many of you might know about already. But we've been hosting presentations on pesticide awareness and health risks. We have been working with our We Act Bilingual Working Group, our NYCHA working group, and have presented at our membership meetings to highlight the different illegal pesticides that are being sold on Uptown, which cause a lot of like illnesses and even deaths, according to the New York City Poison Center. We're currently working on clinical outreach, so if anyone has any connections to like clinics uptown where we can really distribute materials related to these health risks of illegal pesticides, please let me know, because this is something that we're really trying to do with the New York Attorney General Office right now to really help folks become more educated about these different risks. Because, yeah. And then really quickly,
Yeah, let me just interrupt
yeah,
for a
go for it.
moment. We did have a presentation on that topic from an assistant attorney general. Oh God, what was it, a year ago?
something like that.
It could be a year ago. And at that point, I think we gave them some ideas as to some places where outreach could be done or should be done. But certainly we would like to continue to work on that issue with you and with the AG's office.
Yeah, there are street vendor tables on some of the main commercial streets
Yes.
in the area.
No, I think they identified that this is a constant problem up around 181st Street.
Yeah, there's a bunch. So yeah, I'm meeting with them soon, so I'll let them know that folks are interested, and I'll also work to keep you guys in the loop with what we've been doing in the background. Um, but yeah. So another issue that we've been working on is beauty justice, which is focusing on eliminating toxic chemicals from beauty and personal care products, especially those marketed towards people of color. Um, for those that don't know, a lot of different products marketed towards people of color, such as skin lighteners or hair straighteners, have extremely dangerous chemicals in them. Skin lighteners often have really harmful steroids or even mercury in them. And hair straighteners often have formaldehyde in them. And those are often targeted to, yeah, again, people of color. So the justice part of it is really thinking about the disproportionate harm to physical health, but also mental health, because it really forces a lot of women of color and people of color to conform to these different Eurocentric and racist beauty standards. So some of our work right now is our bill to ban PFAS and other toxic chemicals from menstrual products sold in New York State has actually passed in both houses unanimously, and we're trying to continue our advocacy to make sure that governor signs it into law. The Beauty Justice Act is something that is we're going to be advocating for in the next session at the state level, and we're going to be hopefully banning the most dangerous toxic chemicals from the majority of personal care and cosmetic products sold in the state. It didn't pass in the assembly this year, but we're really going to try again in 2026 because it would also set a precedent and an example for the federal level of regulation of beauty and personal care products.
Again, we did get a presentation on that topic from, did I mention the person, somebody from WEACT who came before us?
Maybe like Brianna or Liz, they're on the policy team.
No, it was somebody who's no longer with WEACT now.
Oh, Michaela. She was the director.
Yes, yes. So we are very interested in this topic, and we would like to support your efforts. But could you get us some details about the pending legislation so we can do a resolution in support of the passage?
Yeah, for sure.
Did,
I can.
did the bill was the bill passed in the state senate?
No, I don't. It just it didn't pass in the assembly in 2025 this
Yeah,
year.
okay, but that implies that maybe it did pass in the state senate.
Perhaps I'm not
Okay, well, could
I'm
you
not
get us
fully aware.
get us the details so we know
I just looked it up. It did pass the Senate.
it did pass in the
Yeah,
senate.
I'll
Okay.
get the details from our policy team. We have a specific toxics policy coordinator,
Okay.
Liz. So she handles a lot of that, the policy side of
Okay.
things. But
No,
yeah.
I remember when Michaela made that presentation to us. We were really, I think, almost stunned that these toxic chemicals are in personal care products. So yes, we want to support you on this.
Amazing. Thank you so much. So something that
Sure.
we've actually been doing is the Mapping Beauty Justice project in Northern Manhattan, where we've actually recruited a bunch of community members to use an app called Clearia. And we collected data from beauty supply stores in Harlem and Washington Heights to see in different product categories such as hair care, skin lighteners, etc., to actually try to scan the labels and see what ingredients are in the products sold in local beauty supply stores. So these are like non-chain beauty supply stores that we visited to really capture an authentic like shopping experience for folks in the area. And the results are coming soon. We're still kind of analyzing and parsing through the data that we collected. But this is an effort that we did for like a month and a half earlier on the summer with a bunch of our community members. So we're really excited to share our results, and hopefully I can
Yeah.
come back and present
Yes,
our
please.
share
Yeah,
this.
obviously, we would be particularly interested in hearing what you found in Washington Heights stores.
Yeah, for sure. And then we also have been working with the New York Attorney General Office. This is not specifically my area, so I might not be able to answer too many specific questions about it, but I can pass it on to my coworker, May Kennedy, who's been working a lot on that aspect of our BD Justice work. But we've been partnering with the New York Attorney General Office to um, kind of come down on some retailers or distributors in New York who have been, selling skin lightening creams illegally. So, or distributing them to probably retail stores. So I think there are going to be more updates on that as they come, but it's just so folks are aware that that the New York Attorney General Office is aware, because it's been really hard to regulate. Yeah, whether you hear it from like the Department of Health in New York City or the New York Attorney General Office, it's just very hard to really regulate the sale of these products because they will always just find their way onto shelves. So a really big part of our beauty justice efforts are really education and awareness, and really unpacking conversations of colorism and racist beauty standards that will really help folks, and specifically consumers, change their habits, or at least, think about their use of these different beauty products. But I think, yeah, this
Well,
is my last.
well, I think we would all agree this is important work. Um, is there another slide?
No, this is actually my last slide. I wanted to go through
Okay.
it pretty
All right, very
quickly,
good.
but if anyone has any questions, let me know.
All right. Do we have questions?
Yes.
Normandy. One second, Normandy. OC, do you have anything? No?
I had something and it escaped me. No, I guess not.
Okay, Normandy.
Yes, hi, my name is Normandy, and I have a mental health prevention education. I would like to invite you to come to our community. I just have many churches at this moment. They are waiting for service. What day you might be available?
Okay, well, I tell you what, I will send you her information so that you can communicate directly. All right,
Yeah,
very good.
that'd be really helpful. I wasn't able to hear it that well, so I'll drop my email in the chat too.
All right. Right, OC.
Yeah, before I let you go, I'm sorry. I just realized when you were talking about pesticides and I forgot was the other thing, but there is a little table on 207 and Broadway where they sell all sorts of things. And a few weeks ago, I just passed by and I forgot what's the name of the really toxic illegal thing that come in a white. I think it's a paste or something. It's come in a white canister. I'm spacing on the name, but it was definitely sold at that table. So just in case, if you guys are walking around or you have a team that is looking for, where illegal pesticides are getting sold. So you should really check 207 because there are quite a few vendors over there, mostly, household or whatever, but every once in a while you will see a little corner on the table where they sell those pesticides. So
Yeah.
something to check.
And are there tables like that also on Dyckman Street?
Yeah, I think they're like really everywhere.
Yeah.
I've seen them
Yes.
in a lot of different places, but I know the 181st ones are like the
Yeah.
most,
But we,
evident.
but I think what this points out is that we shouldn't just focus on 181st Street, that it's maybe a problem on all three of our major commercial streets, including Dyckman and 207.
207, yeah. Yes.
All right. All right. So Danielle, you're going to keep us posted. You're going to get us more information about the Beauty Justice Act, and you're gonna stay in contact with us, right?
Yes, 100%. I will try to see if, yeah, I'll try to get my policy team in contact with you all so that they can better answer some questions around that. But
Send us some copies of the Climate Ready pamphlet.
yeah, for sure. I can send this presentation and the pamphlet and create some, something that you can forward to your members so that you
If
can
you have
get the
physical
information.
versions, then we could have them here in
Yes.
the office also.
Yeah. It would be nice to have the pamphlet available here, but at least start out by sending me a copy or two so I can look it over um, and see if I have any additional suggestions. All right, very good.
Amazing.
I'm glad we connected with you and that you were able to speak to us, even though you're not feeling well.
Yeah, thank you so much.
You're well again.
All right, so yeah, hopefully you'll recover soon. Thank you so much, Danielle.
Thank you for having me and have a good night.
All right, take care. All right, next is usually our presentation from the health department, but Pauline Ferranti is under the weather. She says she lost her voice. Hope she finds it. But let me just say that in terms of COVID-19, two of our zip codes are have had fairly high. Something, this can't be current. These might not be current hospitalization rates, come to think of it. Because apparently they go back to October. So maybe the health department website wasn't keeping stuff up to date. But what it showed is that the hospitalization rates in zip codes 32 and 33 were fairly high. In 33, the hospitalization rate was 8.5 per 100,000, and in 32 was 7.9, and the other two zip codes were de minimis. But in terms of emergency department trends for the week ending 11/29, which would have been last week, the overall respiratory illnesses, they're now all being grouped together on the health department website. So COVID-19, flu, RSV, and other diagnoses show a 29% increase for last week. COVID-19 exactly 29% higher. Flu is at 112% higher, and RSV at 58% higher. So this is apparently the time to get your flu shot. What is it, OC?
Yeah, I had something for Pauline, but I want to just say that once you're done, something.
I don't have anything else.
Okay, so I am unfortunately continue the the rooster situations that unfortunately continue on. And the individual, I'm the neighbor on Arden that reported back to us I believe it's now, what is it, a year and a half maybe that it's going on. Say that some roosters, adult roosters had been removed. Many chicken and adequate shelter out in the cold. A young rooster that will soon be, it's just growing up and will start making noise. Um, and so she thinks that the cycle just continue on until they will get to the bottom of it and remove all the roosters. And maybe we'll have to go back there, every month or two or whatever. It's not going to end.
This is just incredible. Do you have Pauline's email?
I believe I do.
Yeah, you should email her.
I was just gonna add, we discussed this last night at the public safety meeting, so the 34th precinct is aware of this and have been actively going back to that location. If there are more roosters, if they do see more roosters, they will remove them. Probably good to follow up with Pauline too. And I don't know if you had a similar report, OC, but I understand that some folks in the building who are communicating with the individual who owns the animals. Some of them have apparently there have been like threats of violence or something like that have been made, and so the other thing that we're asking from the NYPD standpoint is for anybody that has experienced that, they should file a police report. And that will also help with the situation that's going on there. So it needs to be a whole thing for sure. But just to share what we discussed last night.
All right, that's helpful. Thank you, Jacob.
Thanks.
All right, so if you write to Pauline, let her know that that the 34th precinct is also prepared to take action.
Yeah.
I thought that the office of the mayor got involved when we discussed that last month, I believe.
I think they did.
Pauline said that the mayor's office got involved. So I wonder, I guess it's again a question to Pauline. If the mayor's office is involved, why are we still in that same situation?
All right, well, but please email her and copy me on it.
Will do.
Part of it might be that we are in a moment of past, present, and future mayors.
Well, we still have an active city government.
Well,
Okay, thank you, OC. Next, our report from New York Presbyterian Hospital, Julio Batista, Community Affairs Liaison. You have a report for us, Julio?
Hi, Steve. Not per se. I mean, I tried to get I know you're interested in the COVID numbers. Didn't get that, but I'll continue to try to reach out to them tomorrow morning and make sure you get this for your report.
Is it possible for you to also get numbers as the health department is now reporting on flu and RSV?
But I'll inquire from the.
Yeah, it would be nice to have figures that mirror what the health department is reporting.
RSV and flu as well.
Yeah, because, yeah, they're providing citywide figures. It would be nice to know what the local situation is.
In terms of data, probably from the ED or something like that.
Yeah, yeah, their figures are based on the ED.
Yeah. All right, so I'll inquire with them. Reach out to them tomorrow.
All right, thank you.
Shots. Community affairs team was very busy. They've been doing the Stop the Bleed, CPR, mental health trainings. Unfortunately, things are getting to be very challenging because of the current climate. You have a lot of folks in our community who usually go to these things and for the training are very afraid of really what's happening out in the community, especially when you have, on 157th Street, ICE agents in masks pulling people out of cars. So that has ripple effects around the community, and it certainly has. You've seen it in terms of participation, folks in the community. The other thing I mention is I know that you'll get a report from great nurses at New York Presbyterian in terms of the contract negotiation. Those negotiations are ongoing. Hospital in good faith. Also, just want to report that similar to Health First, where it came back a few months ago, talk about the contract negotiations. Our United Healthcare contract expires at the end of this month. There were letters that were sent out by United to their members indicating that they could be out of network if their contract negotiations does not conclude by the end of the month. This was on their website as well. We sort of feel that, as in the past, these things come to the very end and hopefully comes to a positive resolution. I sort of feel that hopefully going in that direction or that mindset is because United did have language on the website with regarding to that, regarding the out-of-network possibility, and that has been removed from the website.
Oh.
So, hopefully by the end of this month, there will be a contract, and that will be settled as well.
But with Health First, the contract was not actually it hadn't actually reached an expiration date. The hospital evidently said it was going to terminate it before the normal date. Is that the same situation here with United Healthcare? The United Healthcare contract was due to expire, and United Healthcare is a huge, as we've learned in the last year or so, is a huge huge enterprise. So this theoretically at this point affects a lot of people here in Washington Heights and Inwood.
Yeah, throughout the entire city.
No, I understand, but It's a major insurance carrier.
Correct.
Yeah.
But we're hopeful.
But you're hopeful it'll be resolved,
That'll be resolved as other
as the others are.
scenarios have occurred.
All right. All right,
And I apologize, I have to leave because I have to go to the Chamber of Commerce to have their fundraising for toys tonight, so
oh, yeah, but you
I don't know if.
Okay.
anything-
know,
Thank you.
as you know, I think I copied you on the email, after seeing an article in Time Out New York that, the new restaurant replacing Coogan's would only be open until the early evening.
See, we realized the dinner for you and having a gathering food is very important. They're gonna be open.
I was promised that this restaurant would be,
Everyone or just
I used
for
to
the-
love that restaurant.
Well,
Yeah.
they're still, hopefully within the next, few months, they will.
We were promised that all 3 square meals could be provided there.
yes, but this article suggested otherwise, that it was gonna be closed in the early evening. But Joe Ianuso, who's what, the real estate guy? or-
Yeah, the senior VP for facilities.
Okay, well, he reiterated, the fact that it's supposed to be open for dinner.
Yeah.
All right, well,
That's
So
the perfect health
because you not
environment.
get breakfast.
it's an important health and environment issue for me. It keeps me alive.
Yeah.
All right.
The thing, Steve, is that it's plus from what we had before. I mean, no one could replace Coogan's.
No, of course not. No, that's out of
But I
the.
guess, with this new establishment, it does open earlier because you get breakfast now.
I know, I saw that, yeah. Yeah, that's an extra. All right, okay, that's our report from New York Presbyterian. Thank you, Julio. Now, from Columbia University Irving Medical Center, do we have Diego Quintuna? Is
Yes,
Diego
I'm
with us?
here. Good evening.
Diego?
Can you hear me?
I'm very,
Yeah, it's a little quiet on our end, Diego, but we can hear you.
yeah.
Oh,
but,
can you hear me now?
Yeah, very,
Much better.
much better, much better. Go ahead, Diego.
Okay, sorry. Okay, good evening, everyone. So this is our updates. So we kicked off Winter Haven lighting ceremony yesterday, at the Haven Plaza, just to celebrate the holiday season. So it was a very great event. Moving on, we have launched our Medical Center Neighborhood Fund MCNF application, which launched on December 1st. The fund is made possible through generous contributions of staff from Columbia University Irving Medical Center, New York Presbyterian, and the New York State Psychiatric Institute. The fund supports vital services such as arts and recreation, food and housing and security, and other social services. And the deadline to apply is January 28th, 2026. So we highly encourage local community-based organizations to apply to the MCNF. We also launched our COIMC annual toy drive, which started on December 1st and will end on December 18th. COIMC faculty and staff are encouraged to donate toys, which are donated to local daycare centers, Head Start programs, and other community-based organizations in Washington Heights and Inwood. And the toys can be dropped off at various locations throughout the campus. We also launched our hands-on science, technology, engineering, and mathematics STEM initiative, which is a partnership between Columbia University Irving Medical Center and local schools. And the hands-on STEM initiative provides essential science supplies to classrooms in Washington and Inwood. And this year we are supporting several donors choose projects created by educators in local schools such as PS48, PS8, PS128, and PS115. I also want to announce the Yes in the Heights internship. So the Herbert Irvin Comprehensive Cancer Center, they launched their Yes in the Heights internship application last month. This internship is an 8-week summer internship for high school and undergraduate students that aims to increase the pool of underrepresented and under-resourced youth entering the STEM fields. The applications are due on January 9th, 2026. We also concluded our COIMC annual community food drive, which rallied our campus community to donate canned goods in support of families facing food insecurity in Washington Heights and Inwood, and all donations were delivered to Fresh Youth Initiatives, New York City's only youth-run adult-facilitated food pantry. So thanks to the generosity of our campus community, we collected nearly 1,000 food items, which were distributed to 150 plus local families. And this year's food drive ran from November 5th through November 21st.
Diego, before,
yes, go ahead.
Diego, before you move on,
Yes.
what did you just say a moment ago about the food pantry at Fresh Youth Initiatives? How did you describe it?
A youth-led, adult-facilitated food pantry.
A youth-led adult
Facilitated,
facilitated?
yeah.
But did you say it's the only one in the city or something?
To our no, not in the not in the city, in Washington Heights and Inwood, to our knowledge.
I see. Okay.
Yeah,
Yeah.
yeah.
No, I mean, no, and where is it? They were located at one point, I think, up in Inwood. Do you know where they are? Where is that food pantry?
There are a few blocks up from our office. I think in 171st, if I'm not
Oh,
mistaken.
yeah.
They
They
have a building.
Yeah, they have the building at 505 West 171st Street.
Yes.
Yeah, okay, that's where the pantry is now? Okay, very good. All right, well, we normally don't focus on that fact that that pantry exists. Thank you for bringing that up.
Of course. So other updates.
Thank you for supporting them.
Yeah, of course, always. We're always happy to support FYN or other local CBO organizations in Washington Heights and Inwood. So this is great. So other updates. So focused ultrasound passes first test and treatment of brain cancer in children. So Columbia University researchers are the first to show that focused ultrasound, a non-invasive technique that uses sound waves to enhance the delivery of drugs into the brain, can be safely used in children being treated for brain cancer. I added the link to the article as well in my update. COVID-19 vaccination lowers long COVID risk in adolescents. So adolescents who were vaccinated against COVID-19 were less likely to develop long COVID after their first SARS-CoV-2 infection than unvaccinated peers. This study finds. These findings provide evidence that COVID vaccination has an important secondary effect in helping to mitigate the risk of long COVID in adolescents, says Melissa Stockwell, a pediatrician at CYMC and clinical senior author of the study. And I also added a link to that article as well.
Well, that word has got to get out. That, I wish somebody could explain that to Robert F. Kennedy Jr. That's important. That's important for people to understand.
The parasite is great.
Yeah.
Another event that's coming up, Late Night Science, What Moves You, How the Brain Learns to Control the Body. So immerse yourself in the world of scientific research while learning about how the brain controls the body and to our research lab. So Dr. Carlos Velasquez from the Daniel Wolpert Lab will be hosting this event. And this event will be taking place on December 11th from 7 p.m. to 8:30 p.m. at the Jerome L. Green Science Center at 605 West 129th Street. And I also added a link to RSVP there through Eventbrite.
So the late night science is from what time? 7:30 to 8:30?
7 p.m. to 8:30 p.m.
Well,
sometimes they fluctuate in time, but it's usually between 7 to 8:30 p.m.
I want to tell him you should rename it the early evening science.
And then finally, the lung cancer screening on wheels. So a first of its kind mobile van rolled onto the streets of New York City to deliver cancer prevention to the homes of millions in New York City. So this mobile lung cancer and health screen van removes the biggest barriers to lung cancer prevention, which they say geography and complexity, by meeting people where they are for their care. This van is powered by Weill Cornell Imaging and NYP, Columbia University's Herbert Irving Comprehensive Cancer Center, and the Sandra and Edward Mayer Cancer Center at Weill Cornell Medicine. And I also added a link to learn more and to schedule an appointment. You can also use that link as well.
And I'm sorry, and this mobile lab is will it be stationed at various places in Washington Heights and Inwood?
It'll be citywide in all 5 boroughs. But you could call and schedule if you wanted to come to an event.
Well, see you can find out if it's going to be when it might be located here in our community.
Okay. They have a calendar, so I'll double check and then I'll forward the information to you with upcoming meetings.
That would be most helpful.
Okay, yeah, and that's all for my updates.
Well, that's quite a bit. I mean, that's a lot of stuff. I gotta manage to get your updates circulated to all the board members. There's a lot of important information there. You were present earlier, I assume did you hear Dr. Gordon's, discussion about, his HIV/AIDS program and, the impact of the federal, the
Mhm.
cuts in federal grants? I mean,
Yes.
it would be good at some point if we could get a better overall picture of how these, federal cuts are affecting, Columbia, and, overall, and the fact that, I mean, as I mentioned earlier, it seems to me that Columbia at this point has lost at least $200 million. I mean, it's, I'd like to get a better understanding of what the impact of that has been on your ability to do research, up here at the medical center.
Yeah, that's something I could circle back with Ross. He's the
Yes,
Yeah,
one that knows
Ross.
most. Yeah, so I'll reach out to Ross. I know he presented a few months ago, and I think
but I
he,
think that might have been before we really, knew, the outcome of the
yeah.
negotiations, between Columbia and the federal government before that,
Hmm.
deal was cut. So, now that it's happened, and you got back some of the money, but you still lost,
Hmm.
as I see it, $200 million. I mean, that's incredible. And then there may be more cuts coming down the road. So,
Yeah.
it would be good maybe to get an update from Ross at some point.
Okay. Sounds good.
All
I'll
right.
definitely relay the message to them.
All
Thank
right,
you.
well, thank you a lot, Diego. And I know that
Thank you so much.
Sandra wanted to come before
Mhm.
us and make some kind of a presentation, so, I don't know if she still wants to do something.
Yeah, maybe hopefully in January if
All right,
there's
all right,
space. But yeah, just let me know. We'll
okay,
be in touch, of course.
very
Thank you
good.
so much.
Thank you. Okay, now our report from, the Isabella Geriatric Center, from, MJHS, the Director of Marketing and Communications, Diane Ashley.
Good evening, everyone. Happy to say that we did not contribute to the increase in numbers in Washington Heights and Inwood. We had no cases of COVID as of today, no cases of RSV or flu.
Very good. Keep it up.
So we will try and do that. I do want to share some really difficult news that I shared at the CB12 meeting last week. And that is that we've had to make the exceedingly challenging decision to sell Isabella. This did not come easy. The decision, we've invested more than $60 million in Isabella since acquiring it. We're losing approximately $6 million a year, and as a not-for-profit, we do not have the resources to continue to sustain those losses and to invest the extensive money that would be needed to renovate the property and make it the way we would want it to be, given its age. Once we made that decision, we set three very strong priorities. We wanted to look for a nursing home operator that had extensive experience operating nursing homes in New York. We want one that has high quality ratings and one that understands the important role that Isabella plays in the community. And we are in the midst of that process now. We do not anticipate that the sale will actually close until early 2028. It is an extensive process, both in finding the right organization and also going through all of the regulatory approvals that are required.
Sorry, Diane, what was that date one more time, just for my minute?
Early 2028 is what we
Okay.
anticipate, yeah. So I just wanted to share that with this group, but I don't have any other updates at this time.
But I mean, if, MJHS, has been losing 6 million a year, how would somebody else be able to make a go of it? I mean, how would somebody else?
I don't know the answer. I can tell you there's been a lot of interest in the property. I don't mean the property as in the real estate, but in
Yeah, yeah.
acquiring Isabella.
And,
Um,
and continuing to operate it.
and can absolutely continuing to operate it. As I said, they need to understand that Isabella is, an important resource to the community. That's a high priority for us.
Yeah.
And so, yeah, it's looking for folks with deeper pockets, high quality ratings,
Yeah,
that can come in and really help ensure the future of Isabella.
yeah.
That's really what the goal is here.
And you think you're saying that Isabella does it need a total renovation to bring it up
I'm
to?
not an expert in that. What I do know is that we believe that the property needs to be upgraded, that the building is approximately 50 years old. And so we would be, anticipating that the buyer would share that same feeling that the property needs to be upgraded.
Yeah.
So again,
Okay.
not something that came easy, and I've been coming before you guys for a couple
Yes,
years now. It's
yes.
it's not something I feel great about sharing at all, but necessary.
All right, well, we appreciate the fact that you're at least forthright enough to let us know, so we don't find out about it second or third hand, or only when the sale is consummated. So I do appreciate that. And it appears as though we'll still have an opportunity to work with you for another 2 years.
Well, we'll see about that, but sure, for a while anyway.
Yeah. All right, very good.
Thank you so
Rich,
much.
don't go away, don't go away. Richard,
Diane, two quick
Yes, Richard.
questions there. Does the proposed sale include both buildings and whatever is the spectrum of services within those two buildings?
Yes.
Okay.
It's Isabella House, which we're just about done completing all but the renovation of all but one floor. So Isabella House and the 4-acre campus on which it sits, and I don't anticipate, haven't heard anything about any change in programs.
Right.
Okay. Second question, and it's more of a speculative question. Is there any reason to think that there is some sort of potential public interest as well as private or nonprofit?
Well, what does that mean?
I was about ready to say I'm not quite sure how to answer it other than this process includes, sort of putting the word out, a bid process, people who wanted more information signed and there's a whole process. At the other board meeting, I was asked if we'd be open to private equity. I should have answered the question with, I'm not sure how that they would have met the first criteria of having experience operating a nursing home.
Right.
But the answer is that I don't even believe it's legally allowed to sell to private equity in New York. But we're not looking in that direction. I'm just responding to a question I was asked at a prior board.
Right.
Steve, I'm comfortable with nothing further than that right now.
Yes.
I'm comfortable just listening to how the process goes forward.
Yeah. Well, I agree. Okay. All right, very good.
Thank you all.
All right, thank you. All right, next is a follow-up report from the New York State Nurses Association on the status of contract negotiations with New York Presbyterian Hospital. We're joined by two of the nurses, Sophie Boland, who's becoming a regular here at our meetings, and Rhonda Middleton Roches. I hope I'm pronouncing that correctly. Who's going first?
I will start.
Okay,
Hi,
well,
everyone.
because you're the one with more experience. Okay.
Happy to be here. Thanks for having me. So just as our update, we've at the last meeting when I reported out, I mentioned our priorities and bargaining. Those have remained the same, and we've been clear with NYP from the beginning what we need in our contract to ensure that we retain experienced nurses and keep patients in the community safe at NYP. So far, NYP has not made any significant moves on any of our major issues. In fact, most of their proposals peel back on rights and benefits we currently have in our contract. Their latest economic proposal would ensure that we either get a 0% wage increase for 3 years or pay into our benefits and pension for the next 3 years. We have our next bargaining session on December 10th, and we have future bargaining sessions scheduled after that. And we are committed to fighting and continuing to meet and continuing to push and continuing to advocate to reach a fair contract, but also preparing and being ready to strike if necessary. We continue to be hopeful that management will bargain in good faith so that a strike isn't necessary. We know how a strike and a work stoppage would impact our community, would impact our patients. We don't take that lightly at all. So this is like, an effort of last resort for us. But it is a move that we'll have to make to ensure that our patients are safe and that we retain the experienced nurses we've fought to attract and fought to train.
Well, it's somewhat dismaying to hear that there's been no agreement on anything.
Yeah,
On none of your points at all, no agreement whatsoever.
no,
Oh, my gosh.
we're really disappointed.
Yeah. Rhonda, do you have something you want to add?
Hi, good night. Yeah, so I just wanted to go over quickly our top 5 because we're trying to remind people every time our top 5. These are the stuff that NYP is not budging with, which we don't understand why they're not budging when we have been in bargaining since August. So it's sad to see that they're playing games with our community, with our patient, and with our nursing lives and our family livelihood. So top thing, staffing enforcement. That is one of the stuff we began with. And from the beginning, they gave us pushback with staffing enforcement. We need our grids to improve. We need to maintain safe staffing for our patients and for our nurses. Job security, we saw this year that NYP did what they wanted to do for budget cuts that they did not need to do. And they cut our nurses, our nurse practitioners, and services that the community needed. So we put across the language to help secure, jobs to help make sure we could take care of our patients. They're not budging with stuff like that. Wage and benefit, we're asking for fair wages. We live in New York. We work in New York. We take care of very sick patients. We do our best. We do an excellent job. We're just asking for fair wages and to maintain our benefits. We're asking to have our healthcare benefit, our pension. We're asking to have these stuff. We're healthcare workers in the health field. And for us to be told that we will have to pay into our healthcare or decide if we could get a raise. It's just not fair. Workplace violence. We are looking for a safe space for our nurses, for our other patients. Workplace violence is something that has increased over the past couple of years. We've been asking for better protection. That, again, something, no movement on. Artificial intelligence, we are asking for a seat at the table to be part of the decision-making process. We have seen how it started to infiltrate healthcare, and we just want to make sure that these stuff are regulated. It's not affecting patients negatively, and it's not taking away nursing job. Nurses were trained, we do critical thinking. There's certain stuff artificial intelligence cannot do that a person can do. So we just want to remind you guys, those are the top 5 stuff that they refuse to come to the table and bargain in good faith with us. Like Sophie mentioned, we're preparing for strike votes right now because we're 27 days away, I think. Strike is always the last resort, but management is not meeting us where they should be meeting us. Therefore, as nurses, we know that we have to plan. Anybody know you got to plan when you see something going down the road? Some nurses who used to be travel nurses are getting these notification. Oh, we're preparing for strike. The hospitals are preparing for strike to pay you 8,000, 9,000. Why are the hospitals preparing for that? So we're getting a lot of message from the other side, management side, the hospital side, that they're not bargaining in good faith, but they're preparing for a strike when we were not. We're bargaining. So now we're at the point where we have to do our strike vote and start to prepare our members. This is something that happens during negotiation when we're coming to an impasse and the deadline is coming up. Our deadline is December 31st. Like I mentioned, this is something strike vote that happens anytime agreement is not there. It is not new. All of a sudden now, NYP refused to give us a room. They usually give us a room or allow us to do our strike vote where we're asking our nurses, this is what's happening. Where do you stand? Currently, we don't have a place for that right now. I don't understand how that's bargaining in good faith. And we're just trying our best, keeping our head up and trying to fight for our patients and for our nurses.
How many nurses are we talking about here at the medical center?
About 4,400 nurses.
And I'm sorry, and does that include the Allen Hospital and
Yes,
Children's Hospital?
across Milstein, Choney, Allen, and the ACN clinics, the Ambulatory Care Network, there's
Yes.
4,400 nurses.
Oh my gosh, 4,400. Let me just say that after our last meeting, there would, I mean, I took away a lot from the last meeting, but there were two particular issues that I raised with the hospital around workplace violence, because I'd never really heard that issue before. And you know, they told me when I raised the question about putting like plexiglass barriers at the desks so that you would not be confronted by violent patients or people who were throwing objects at the nurses, which, you know, I thought this was an easy ask. I thought this was something the hospital should easily be able to accommodate. You know, and they told me they had not heard about this before. I think they agreed with me that it wasn't a big thing to try to get, and they told me that they would be looking into it. So I would have been hoping that by now they would have gotten back to you to say that this is something maybe they can do. The other thing that struck me last month was when you said that the security officers don't intervene unless a nurse has actually been manhandled or has somebody's actually touched you. So they deny that. They say that's not the case. They say that once there's some kind of a threat made or whatever, that they don't wait for you to actually be molested.
Yeah.
So,
and that's part of the problem, right? Like, you know, if we bring concerns to them and bring issues to them and they're saying it's not happening, then where do we go from here?
But I personally, I would be particularly interested in knowing how those two particular issues get resolved, because I did raise them when I had a meeting recently with some of the top hospital officials.
Thank you. Appreciate that.
Yeah, thank you. So they're currently not resolved, and that's what we're facing since August, where they just play word games and just deny stuff. We have nurses come in and testifying and basically being ignored. If somebody tell you this happens to them, you can't just say it didn't happen to them. And that's what we're facing, unfortunately.
Right. Well, I think it's certainly in everybody's best interest to see that this gets resolved. And it, you know, maybe it goes up to the 11th hour or even the 12th hour. But we certainly we don't want to see any of the nurses walking on a picket line. We want you doing the job that you were trained to do, and that most benefits the community.
Yeah, we agree.
So, all right. Well, good luck to you, and keep us posted. I assume Nick is on the call too, and is attending this meeting, and is also going to keep us posted.
Yes, he is.
All right, very good. Thank you.
Thank
you, guys. Good night.
Sophie, you're getting better and better with each meeting. All right, very good. Thank you.
Thank you.
All right, next is old business. OC, you have old business.
Yes, I do. So, I got a word from the ASPCA just 2 days ago that they will have some dates that for spay neuter and vaccine wellness vaccination clinics for our district. Zip code 10032, 33, 34, and 40 on, they had one on December 1st and 2nd. Unfortunately, I didn't get it earlier to ask the office to post, and I don't really know that they would have posted anyway. And then there is one on December 8th, another one on December 15th, and the last one on December 29th. So, Steve, maybe you can help and ask the office or Catherine to post that to the list.
Yeah.
It's,
Yeah,
I
yeah.
have the flyers. I have the
Oh,
flyers.
they're
I can
all-
put, it's in
well, they're-
English and Spanish.
Perfect.
And so, I mean, but it's just something that so far, the office really didn't help promoting those services. And I think it's important that we be more proactive about that in order to get as many cats and dogs fixed in our district.
Yeah, well, send the flyers to Paola and to Noemi and to Kathy and also to me, and let's get it done.
Okay, well, my point is that that cannot be at the bottom of whatever newsletter, or
Yeah.
that has to go as an individual, as
I
a
agree.
standalone email.
Yes.
So please help
Okay.
with that because,
I will.
okay, great.
All right, again, good work, very good work.
The general meeting is earlier this month. I mean, there's-
16th.
Yeah, so there's only one date after, but
Yes.
at that meeting, we can say, hey,
Yes.
you missed this,
Yeah.
29th.
Yeah.
Right.
Yeah.
Yeah.
All right, very good. I don't have any old business. Anyone else with old business? No. Any new business? Normandy, do you want to give us some more information about your program called Smart Steps NYC? So this is Normandy Maria, the founder and director of Smart Steps NYC, who is joining us tonight.
Hi, everyone. Smart Steps NYC is a mental health preventive education program. This is more focused in our community, Hispanic community, to prevent mental health. It's open for everybody, but our concern is to educate people to reduce stigma about mental health and prevent to young people getting sick, get some mental health. I see parents sick, especially single parents. The majority of the time, a lot of students, they cannot perform well in the school because mom died depressed and they not understand what happened at home, and they cannot concentrate at the school, and they cannot be productive as well. So our mission is just to educate New Yorkers how to recognize signs and symptoms and prevent any condition in the future, mental health. When we talk about mental health, we just talk about nutrition, we also talk sexual orientation, anxiety, trauma, stress, all of that, especially single mom, which we're very focused in happy mom of the family. Because when you impact the mom and you educate the mom can be the support of the rest of the family. And we also have at the program which we developed for teenagers to help teenagers, especially in the school and in youngest. And right now we're working and to develop a program just for seniors 65, just to we start already to visiting them, different places, churches, to let her know they're not alone, that we're there for them, and to bring more information and make them to socialize one to each other and let it talk and let it talking about the something about the past, bring memory. By bring memory and we bring food to them. Also, we bring someone who sing it for them activity. They make them a little more part of the community because they feel isolated, lonely at home. But with those activities, they feel like someone care. They go to the one place in the church. They let it use us and they invited us, and I see they come like 80 and 100 people on Sunday to the meeting after the mass at the church. They come, but unfortunately, we our resources, which I'm the one who funded with my job this organization right now, limited to help more people as well. I want.
And where are you located?
It's a mobile program. We go where they invited us. My apartment is my office.
Oh, I see.
My
Okay.
apartment is my office.
And are you? Do you reside here in Washington Heights?
My parent, yes. After the business here in Ottawa.
Oh,
Yes.
your parents have a business.
No.
Oh.
Say the business here, registering in Ottawa. I just moved a little far, but I spend a lot of time in the community because I do community service
Right.
since I'm a child in here. I grew up in here. This is my community.
Right.
Washington High.
Right.
I grew up in Carnation, and when I was 18, I was the president of the youth.
Yeah.
So I go in there and I continue provide service to whoever needed, whoever had needs in Incarnation and many church around. I never disconnected. My professional service, I've been donated for many years
Right.
to our community, which has made me, it's like my passion.
Right.
Service, all this is
Right.
my passion.
Are you a psychologist?
Yeah, I'm a psychologist. I have a master's degree, and
Oh.
right now
Right.
I'm trying to finish my doctor's degree. But at this
Right.
moment, I have intervention psychology.
So everything you're doing right now is you're donating your time. You don't.
I have 3 years with my organization,
But-
and I donated.
But is there funding for what you do?
No, nobody.
No funding.
No funding.
So how
Not
did?
yet. This
so-
is the first time that I come to the meeting and
Yes.
process. So,
So you have. So you can't do this full time. You have.
no, I have my professional job.
Right.
But this is crazy because people calling all the times, churches.
So you see other patients as part of your.
No, we don't see patient. I educate. This is an education program.
Right.
This
But in your
in my
normal.
business,
you-
normal life, I have an education program,
Uh.
which I used to work for ACS and HRA.
Right.
And me and my family donated as much as they can. They help me because they know that this is what I've been doing many years.
Right.
That's not new. It's just that we give you a name. Before they don't have no name.
Right.
What was community service?
Right. So
My
you-
passion? Yes.
So you can't do this. You can't be doing this full time because you have to make money doing
To
something
make
else.
money to
Right,
to
right,
support the-
right. So
Yes.
so you're sort of doing this on the side while you're doing your normal professional business.
Absolutely,
Right,
yes.
right.
If one day we have the opportunity to dedicate 100% to educating,
Right.
preventing our community,
Right.
it will be wonderful.
Right.
But at this
Right.
moment, I'm the one that
Right.
I funded my projects.
Right. Because I don't know, every year we have to develop annual budget priorities for the community for what we want to see in the city budget. And this committee, for a number of years, has said that mental health services is the number one priority.
It is.
Right.
It is.
And
I believe that when someone is on control of his mind, they can be productive for the community, but also in helping others. And at the same times, can be the facilitator for others, because when anyone have mental health in the family, the rest of the family, unfortunately, they had to deal with
Right.
the situation, and they not understand because no one come and educated. My mom do not have that opportunity. That's why calling Healthy Mom, my first initiative from the program was Healthy Mom, Healthy Family. Because my brother have a mental health, so car accident, he came from work from downtown, and he was in the hospital here, 168, 1 year in coma. And nobody educated my mom. My mom doesn't know. By that time, nobody know. Nobody told her nothing. So she gets sick. My mom had developed anxiety, heart problems, and I want to help a lot of moms. They might have some situation like everybody has some friends, some family, or at work to deal. So we want to run together with all the professionals that are willing to help me. So education is number one. If we need education, it has to be first education about mental health. The rest we can produce.
So what you generally have been doing is running the program by holding like small group meetings with church out of the churches
The church and friends, you know.
and friends anyway. Yeah.
Sometimes having meetings, my friends' house, 10 people. It's crazy how they want me every weekend.
So
In church it's 100 people. We're
Right.
doing what? Nutrition.
Right.
We're doing what is exactly anxiety, what type of anxiety, because they have 4 type of anxiety, you know. And what is depression and how you might handle it is. People know, oh, anxiety, oh, depressed, but they don't know exactly what it is. What is all the part that being affected by you, someone being distressed. If I'm working with her, I'm co-working, I'm passing all my stress, and I put all my stress on her. At the end of the day, she go home, and she's a young woman, she will be stressed, and she cannot be productive as well. She might can do it, you know, and pass it to parents because parents see her that she's tired, that she's sad, and she might not even know what happened to her. It was someone at work or someone in the school that's stressing her.
There is another committee called the Northern Manhattan Agenda Behavioral Health Committee, which is made up of people who do provide mental health services in Washington Heights and Inwood. And I'm wondering whether they might want to hear from you as well.
I will appreciate it. Yes.
So let me I'll check with them, and I may send you their information. Well, you know, so I'll just send it to you, and you can reach out to them and ask whether or not they would like you to come to one of their meetings.
If you send it to them, I appreciate it.
Yeah.
Because if you send it, they already will
Yeah.
give me more opportunity for me.
Okay, well, let me check. I'll check with them first. Okay.
Thank you so much. And let me say something, I'm looking forward to work, not only with a mom, but teenager. Because sometimes teenagers, young people, they get empowered and help the whole family.
Well, I tell you, one of the programs we have in this community, although I would love to see it expand greatly, is Communal Life. Do you know that program? Because they they are focused on Latina teenagers and try to prevent suicide and other things. And
I do training as an instructor. I can provide a mental health first aid training. If there's anyone want to
Good,
the training,
yeah.
which is 8 hours,
Yeah.
they have certificate. We
Yeah,
more than happy to go and provide the.
because I could see you possibly working with this group, Communal Life. And I think they have an office on Amsterdam Avenue. But
Please,
yeah,
I will appreciate it.
but they're also part of this larger committee of mental health agencies. Richard, you have something? Oh, okay. Any other questions or comments?
Yeah.
Just,
What?
No, I have an update for the announcement I gave about the ASPCA. So let's finish with
Okay,
that
very good.
topic.
Wait, I just wanted to say thank you for the work that you're doing, and I think it's really a wonderful initiative that you are building. And so very glad that you came to speak with us tonight. Appreciate that.
Thank you to having me here. For me, it's a pleasure to be here. I was a little shy to come, and Mr. Smith was pushing me. You know, organizations for the community is everybody. And I've been, you know, I work keeping myself and pay for all the events. And I say, this is something that everybody should know. You know, not only a few in church, everybody should know. And I say, I had to go. I came from work. I'm a little tired, but I will go.
Very good.
I'm glad you came.
Okay.
Thank you.
All right.
Here too.
Okay, thank you. OC, back to you.
Yeah, so an update. The dates I noted before was only spay neuter clinics. Okay. In addition, we're gonna get wellness and vaccination clinics on December 10th, the 15th, and the 23rd.
Wait, say that one more time, sorry.
The wellness and vaccination clinics will take place on December 10th, the 15th, and the 23rd.
Okay, thank you.
Okay, so all the data I gave you earlier were all spay neuter.
And
Amazing.
do you also have flyers for the,
I do.
oh, great. Okay, very good.
Yeah.
Okay, all right, so I just got an email from, our contact at DEP telling me that he couldn't send us, the regular monthly report, because he had to attend to a water main break on 108th Street.
Not us.
No, they missed us this time.
Dave,
So,
was that direct information or was that just a leak?
Richard,
All of us owe you a few.
yeah, my God.
Motion to adjourn.
Yeah, but, I don't know. On that note, I don't know what you're out of order. All right, okay,
Stay out of
there you go.
Oh my God.
Oh my God, I'm being punished for, okay, are there any announcements? No, okay, so, our next meeting is, Thursday, January the 8th. And, I wish everybody a happy holidays, a happy new year. And, we, will reconvene then. Thank you all for attending.
Thanks. Have a good night, OC.
Okay, so we're
Good night,
closing this
thank you.
meeting we're closing this meeting at 9:08 PM. OC, OC, I think I may have seen your husband in the background. I hope he's doing okay.
Thank you. Thank you.
Dave, but appreciation, the meeting had a good flow too.
It did.
I mean, it did, but goodness gracious.
Hi, Amy.
I didn't nice to meet you.
Nice to meet you.
For some reason, I don't have any Dave with.
Jacob,
Jacob.
pleasure to meet.